Bismillahirrahmanirrahim. Yes. Assalamu alaikum. Yes. I hope everyone is doing well. Sorry about the technical error today. I tried to join from a long time, but I think there is something about internet. I hope that everyone is hearing me in a good way. I see that someone is talking about the participant. Okay. I will try to mute everyone. So, okay. So everyone is doing well. I think we can just share now the screen. I don't know if the voice is reaching well, or we can.
We hear nice, Dr. Mahmoud. How are you, Dr. Mahmoud?
I'm fine.
We are hearing you very good.
Yeah, thank you. Thank you. Shukran, Dr. Ahmed. Thank you. So let's start. I try to today to collect the final session, and to, as much as I have, seems to be some poor connection, but I am trying to get it more. Okay, so let's share the screen. Yeah. Okay. Yes. So let's start with this case, and now I'm downloading it. Start with share screen. Yes. Okay. Yes. Okay. I will try to talk as much as loud I can. Yes. Just I am trying to get a good connection. Yes. To show you the first case. Exactly. Yes. Thank you, doctor. Yes. Yeah. Yeah. So okay. Everything is fine now. Let's see this history.
Yes, we can see the screen now.
Yes, exactly. So this patient have left upper and lower weakness over 2 months, and he already received treatment for HIV. So let's shift to the images and try to find out what happened here in this case. Yes, I think we saw it before, but okay. This patient have something going here, right? And it's showing like there is vasogenic edema, right? We can describe it in this way, especially after we give the contrast and we doesn't take enhancement. So we mentioned that this case, it can be as infarction, but with this history of HIV, you should put something else in the differential diagnosis, especially after you saw the MRI, yes, with this characteristic, and also again with the diffusion, there is no restriction, and there is T2 shine through. Someone in the chat asked me about يعني how to explain the restriction or differentiate between the true restriction and the T2 shine through. So in this case, you have high signal in DWI, and when you see the ADC, it is still high. So this means that is not restriction. This means that this is T2 shine through. That the T2 effect in the water content make masking for the true restriction. So there is no true restriction. And you have this phenomena when the water molecules are moving without restriction. So this means that there is no restriction. Maybe we will see another case that you can understand the differences. I think we reached last time in starting, I think here. Exactly, yes. So let's have this case. Yeah, so this patient, just a moment until, yeah. Non-tender forehead swelling with grow over 2 months, no history of trauma. And yeah, so what is your differential in this case? I think this case can come to you like a short question with differential diagnosis, and I think maybe he can ask you about if you have any differential for this case. So would you like maybe to scroll a bit up or a bit down? Also, someone asked me about the pterygopalatine fossa. So this is the pterygopalatine fossa. And the landmark that you go posterior to the maxilla and you check the pterygoid plate here. So when you find this pterygoid plate, so this is the pterygopalatine fossa. And here you can note this entrance, which is pterygopalatine fissure. Okay, so let's go to our case again. And what is the differential in this case? I'm waiting if there is someone in the chat can give us any, yeah? Yeah, so eosinophilic granuloma, epidermoid, dermoid, MITS, interosseous meningioma of lytic type. Wow, and fibrous dysplasia and hemangioma. Yeah, so hemangioma, I agree with you. And interosseous meningioma, yes, it seems to be something related. But I think if you, yeah, I think one of the important that you should comment in this case, if you are writing the report, there is no intracranial extension, no cortical destruction, and also it will be fine that it's going with the benign nature, right? So do you think so? So let's have a look. Yeah, it seems to be that interosseous hemangioma, right? Exactly. And narrow zone of transition, that's very important in this case. And you are going with something. So let's have a look in this case. We mentioned something already, okay. Yes, so patient have forehead lump, and yeah, this is the X-ray. So already I think that you see in the small picture that there is something going here. So can you see in the X-ray there is anything in the frontal area? Okay, so let's shift to the, yeah, let's shift to the next and see if there is anything else in the CT. Yeah, so the CT in the CT, If you check the previous one, we mentioned that it's very important to check and to mention in your report about if there is any intracranial extension and if there is any soft tissue component. And here, I think you can, yeah, Dr. Fauzi, yes. So why not we agree with you is dermoid? Because what we mentioned now, that you should in the dermoid, for the first instant, you should have something like a fat density or low density. And also you should have benign nature, like something going with benign. So it's different a bit from the previous case. So in your important, if it come to you like this case, like a long case, you should be aware of the Bot's Buffy tumor could be one of the differential, but I don't know if the sinus is here, yeah? So it's a bit far from the sinus, from the frontal sinus, but it still is possibility, right? Here's something also, but maybe it's like small bone island. So Langerhans is very nice. So why we can consider Langerhans, or when we should put in the differential Langerhans? If the patient is young, right? If the patient is young, we should consider it, right? So one of the differential, hemangiopericytoma is not very big differential. You don't have enhancing يعني dural tail mass or extra axial mass. It looks like it is in the bone. MITS will be one of the differential, sure. Okay, so let's go. Maybe there is MRI can help us to reach the diagnosis. There is something going here. Yeah. And I think in the MRI, I think you are searching now for the contrast. So this is the contrast image, and this is the axial post-contrast, and this is the axial pre-contrast. So any difference between both? Do you think that there is any difference between pre and post? And also, if you will ask me, I want to check all the sequences. Let's also check the diffusion, because, for example, here the signal in the diffusion is not high. It seems to be like ISO signal, ISO intense signal to the gray matter at least. And for this, you cannot consider it restricted. Okay. So what else? You mentioned meningioma, maybe, but is not typical. You mentioned hemangio is not typical. You mentioned, so let's go to our CT, congenital, traumatic, inflammatory, neoplastic, and metabolic, and drug-related, and your scheme, yeah. So maybe lymphoma, I agree, maybe lymphoma, one of the differential, but what is against lymphoma here, that in the T2, it is high signal. The lymphoma seems to be more with low signal in the, yeah. So Metsu, again, will be one of the good differential in this case, I agree. I don't know what does mean DWI, yeah. What is mean by DWI? If someone wanted to discuss in unmute, is welcome, he welcomed. Okay, anyway, to go, okay, so this is a pathology. I think now we can find the finding. I don't know that if someone is specialized in pathology or not, but let's go to the differential. Yeah, this is Langerhans cell histocytosis. And as we mentioned, it comes to the young people and generation. And also you should, when you see something like this, with you should put in differential. Metastasis, Langerhans, lymphoma, but don't forget Langerhans, especially if the patient is young, okay? Is a good case of Langerhans. It's not expected, as I see, but you should put it differential, especially, yeah, with beveled age, exactly, Dr. Iman. So one of the good signs here, that the patient already is young age, as I show you the history. That's why the history is very important. And the CT, if you find this beveled age or something called baton baton sign, like, but I think it's not here going with baton sign. But anyway, when you find this beveled edge look like this, so put infection, put eosinophilic granuloma, and anything else. Yes, so don't forget the history. So let's, okay, let's go to the next. I think now we are going in order. Yeah. In this case, type of cases in the exam, you put differential. And concerning the age of the patient, you are directed. So if, for example, if it is old man, sorry, if he old man, so you are going more that it could be metastasis. But if he's young, and especially if you see this enhancement and this beveled edge, so you are going more with eosinophilic granuloma or infection. So I agree with you if it is both buffy tumor or something related to infection, I agree that you could put in differential, but other possibilities could, yeah. Okay, so let's shift to the next case, known case of rheumatoid, and the X-ray of this patient, yeah, okay, yeah, this is the neutral position. So when you find this neutral position and he give you another dynamic positions, so probably it is important to have look in this. When you see the X-ray, you should have, we should have like our checklist, and this checklist, and very, very common, you will see in any place that you work with X-ray, that very, very important to take one by one checklist. So let's apply this checklist and try to find the pathology. In this case, someone sent, yeah, Dr. Ahmed, C6-7 facet, atlantoaxial subluxation. Again, Dr. Hassan, atlantoaxial subluxation. I think here start to be, there's some key of this annotation. So maybe there is widening in the pre-dental space in the lateral flexion view and reaching about 7 millimeters. And there is some spondylolysis, and this makes step ladder appearance. Okay, so what it could be? Yeah, this is what atlantoaxial subluxation, perfect, with or basilar invagination. We mentioned it last time. We've mentioned that you have this very good differential and you have very important differential, and they like it in the exam. So with wide pre-dental space, and yeah, you have this, we mentioned it, I will just show you the differential, yes. This congenital or acquired, and this patient have history of rheumatoid arthritis. So whenever you have this history of rheumatoid arthritis and you have wide pre-dental space, so think about, and you have this line, we mentioned them, McRae line from the Bayesian